If you or someone you love takes Warfarin, this may be the most important 5 minutes you spend today. Because the green salad they had for lunch, the aspirin they took for a headache, and the antibiotic their doctor just prescribed could all quietly make Warfarin less effective or dramatically increase the risk of serious bleeding. Warfarin is one of the most commonly prescribed blood thinners in the world. It is used to prevent dangerous blood clots in people with atrial fibrillation, deep vein thrombosis, mechanical heart valves, and stroke risk. It works, but it comes with a catch that makes it unlike almost any other drug. It interacts almost with everything. Food, medications, supplement, even your genetics can completely change how Warfarin behaves in your body. And getting the dose wrong in either direction can be life-threatening. To understand why Warfarin interacts with everything, you need to understand what it actually does. Warfarin works by blocking vitamin K, specifically an enzyme called vitamin K epoxide reductase. Your body needs vitamin K to activate clotting factors 2, 7, 9, and 10. Without active clotting factors, your blood takes longer to clot, which is exactly what you want when you are trying to prevent dangerous clots from forming. Think of it like this. Vitamin K is the key that activates your body's clotting machine. Warfarin breaks that key. No key, no clotting machine activation, thinner blood. The problem is vitamin K doesn't just come from your body. It comes from your food, especially green leafy vegetables like spinach, kale, and broccoli. So every time a Warfarin patient eats a big salad, they are flooding their body with the exact molecule Warfarin is trying to block. Now, here's where it gets dangerous. Warfarin has what's called a narrow therapeutic index, meaning the difference between a dose that works and a dose that causes serious harm is extremely small. Too little Warfarin and clots form. Too much and the patient bleeds uncontrollably. This narrow window means any small change in the body can tip the balance dangerously in either direction. High vitamin K foods like spinach, kale, broccoli, and Brussels sprout reduce Warfarin's effect, make it less effective, and increase clot risk. This doesn't mean patients cannot eat vegetables. It means they need to eat them consistently so their Warfarin dose is calibrated to their diet. Warfarin is metabolized by the CYP2C9 enzyme in the liver. Any drug that affects this enzyme changes Warfarin levels dangerously. Antibiotic like metronidazole and fluconazole inhibit CYP2C9. Warfarin levels skyrockets. Bleeding risk increases dramatically. Drug like rifampicin reduce CYP2C9. Warfarin gets metabolized faster. Clot risk increase. Aspirin and NSAIDs do not affect Warfarin metabolism, but they thin the blood independently and damage the stomach lining. Combining with Warfarin creates serious bleeding risk. Fish oil thins blood further. Garlic supplements thins blood further. St. John's wort induce CYP enzymes, reduce Warfarin effect. Vitamin E increases bleeding risk. Because of all this interaction, Warfarin patients need regular blood tests called INR, International Normalized Ratio. INR measures how long blood takes to clot compared to normal. Target INR for most patients is 2 to 3. Below 2, not anticoagulated enough, clot risk. Above 3, overcoagulated, bleeding risk. Above 5, dangerous, emergency treatment needed. This is why Warfarin patients see their pharmacist or doctor regularly for dose adjustments. Because their INR fluctuates constantly based on diet, medications, and activity. Here is what everyone needs to remember. Warfarin is one of the top causes of preventable medication error and hospital admissions worldwide. The most common reason, patients do not tell their pharmacist or doctor about new medications or supplements they are taking. Other anticoagulants like rivaroxaban, apixaban, those are the newer drugs which have fewer interaction. But Warfarin is still widely needed, especially in low-income countries, because it's cheap and reversible with vitamin K. To remember Warfarin's mechanism, Warfarin reacts vitamin K. No vitamin K, no clotting factors. Thinner blood. Warfarin reacts vitamin K. Simple. Before you go, Here is a question. Why do beta blockers end in olol and alpha blockers in zocin? That's not a coincidence. I will reveal the simple naming trick in the next video. Subscribe to Clear Pharma and I will see you there.